Hello friends, welcome to Creative Medicine. In this lecture, we will learn about all may all may cause traumatic asphyxia except accidental strangulation is not traumatic asphyxia. Traumatic asphyxia. Traumatic asphyxia is a form of asphyxia in which the entry of air is prevented by mechanical fixation of chest by unyielding object on chest. That means if you put something over the chest and because of putting some heavy object over the chest, the movements and expansion of the chest is prevented. Thus, the entry of air into the lungs is prevented, causing asphyxia. So, traumatic asphyxia is seen in railway accidents, road traffic accidents, in stampedes. In these conditions, some heavy objects like rocks or something in the stampedes or some machine or automobile parts, if they fall over the chest of the patient, preventing the movement of the chest and thus preventing entry of air. That is traumatic asphyxia. Thank you and thank you for watching.